Hi, my name is Doris Onoha. I will be presenting my psychopharmacological case presentation on Haldol. Haldol belongs to a class of antipsychotic medication known as first-generation antipsychotics, sometimes referred to as conventional or typical antipsychotics, mainly for treatment of psychotic disorders such as schizophrenia, schizoaffective disorder, drug-induced psychosis, Tourette syndromes, and behavioral changes in children with combative and explosive disorder. Can be pill or injection form. Haloperidol in the injection form is called haloperidol deconate. Haloperidol is a medication that works in the brain to treat schizophrenia. It is also known as the first generation antipsychotics or typical antipsychotic. Haloperidol rebalances the dopamine to improve thinking, mood, and behavior. These are the side effects that you get with the Haldol: pseudo-Parkinsonism, which is posture, shuffling gait, rigidity, bradykinesia, tremors at rest, p-rolling motion of the hand, acute dystonia, facial grimaces, involuntary upward eye movement, muscle spasm of the tongue, face, neck, and back, and laryngeal spasm, akathisia, restless, trouble standing, pace the floor, feet in constant motion, rocking back and forth. Tardive dyskinesia, protrusion and rolling of the tongue, sucking and smacking movement of the lip, chewing motion, facial dyskinesia, involuntary movement of the body and extremities. So all these are called extrapyramidal side effects of the haloperidol. So in the acute dystonia, you will see it occurs between 1 to 5 days of the initiation of the medication. In Parkinsonism, it occurs 1 to 4 weeks of initiation of the medication. Akathisia occurs 5 to 60 days of initiation of the medication. Neuroleptic malignant syndrome occurs weeks to months, and also tardive dyskinesia occurs months. Tardive means late, and that's months to years. So case study presentation. When is it appropriate to use Haldol? So this is a 23-year-old white male nursing student, was brought in, to Exodus Mental Health evaluation to determine his current cognitive and emotional, status. So his chief complaint was, I have been receiving signals from an electronic device implanted in my body. Believe this device was implanted to his body by government intelligence to control his actions. Present illness, he was diagnosed with schizophrenia 2 years ago, and he takes risperidol, which he said that he, the last he used it was 2 months ago. So we have established non-compliant with this patient. So his medications are risperidol. Schizophrenia is his past medical history, and he uses no substance use, no medical problem, no known allergy, family history. His father has anxiety and major depression. Mother is with diabetes, drug and alcohol abuse, and hypertension. He's a college student, single, with no children, occasionally use alcohol socially on a weekend, like 1 to 2 beers. So no illicit drug use or tobacco use. Past lab diagnostic tests that we found in the chart, CBC, CMP, UA, drug screen, all are negative and unremarkable. His mental status is like he's disturbed, anxious, poor eye contact, beyond terrible, depressed, impaired, believes he has implanted device in his body. He denies HI and SI, positive delusions and paranoia. He's fully oriented, but his judgment is poor. He has no asset, but has medical insurance. Physical finding that he's a Latin-oriented times 4. He appears his stated age, poor eye contact, unkempt, sitting slumped in his chair, bizarre facial grimaces and gesture. My differential diagnosis is delirium psychosis disorder, substance abuse delusional disorder. My actual diagnosis for this patient is paranoid schizophrenia. My treatment plan is Haldol deconate 100 milligram IM. He's gonna be institutionalized at this time, and also followed with prolactin, because Haldol do increase weight, and also patient do get the, patient who on Haldol, they do develop breast, the male. Creatinine clearance, CBC, RPR, UA, urine drug test, CMP, TSH, lipid panel, fasting blood glucose, and LFTs. My plan, non-pharmacological way, is inpatient admission, attend daily psychotherapy groups, support group, and discharge planning. And family do not teaching and patient teaching is do not discontinue Haldol without consulting your physician. If you miss a dose, take it as soon as possible. Do not double dose. May be taken with or without food. May cause sedation and drowsiness. Use caution when driving or performing tasks that requires alertness. Store the medication in its originally labeled light-resistant container and keep away from children. Now, case number 2, when it's not appropriate to use Haldol. This is a 68-year-old man, married, retired veteran. He was brought into Exodus by his son to determine, to evaluate, to determine his current cognitive and emotional status. This patient's chief complaint is I see people walking in circles outside of my window asking me to come and join them. So he has a history of dementia, diagnosed 5 years ago, hypertension, hyperlipidemia. He's on Aricept 5 milligram daily, Novas 10 milligram, and simvastatin 40 daily. His past psych history is dementia. He takes Aricept. He has no substance use. Medical history is hypertension, hyperlipidemia, has no known allergies. Family history, mother died of stroke. And then father is 92 years old with hypertension, diabetes, and GERD. He's a retired veteran, no substance use, denies alcohol, quit smoking 15 years ago. Diagnostic in a chart is CBC, CMP, UA, lipid panel, TSH, and they're all unremarkable. He's fidgeting, his mental status exam is fidgety, poor eye contact, disorganized, anxious. His thought process is loose association. Thought content is negative for SI and HI. Poor judgment, impaired sleep. He owns a house. He has Medicare medical insurance. Physical findings, he's alert. For the case formulation session, he's alert rated ×1. Appears stated age, disheveled, anxious, staring out the window during most of the examination, asking, did you see them dancing in circle, fidgeting with his hand? My differential diagnosis is delirium, psychosis disorder, NOS, schizophrenia, substance abuse, dementia, delusional disorders. My diagnosis is dementia-related psychosis unspecified, and hypertension, hyperlipidemia, and dementia. My treatment plan will be Risperdal, 0.5 milligram POBID for dementia-related psychosis. And also with other some labs, CBC, CMP, LFT, ESR, urine drug test, UA for UTI, because UTI is common among this age, ANA, TSH, lipid panel, HIV, CT brain, or MRI. Family history, do not discontinue Risperdal without consulting your physician. If you miss a dose, take it as soon as possible. May take with or without food, may cause sedation or drowsiness. Use caution when driving. Store the medication in its original label light-resistant container. Keep medication away from children. Case study number 1. Evidence-based of Haldol. First developed in late 1950s and first antipsychotic medication, research showed its therapeutic effect on symptoms of schizophrenia, such as hearing and seeing things, having strange belief. On a study to evaluate the effect of haloperidol for schizophrenia and other similar serious mental illness, haloperidol was found to be better in treating schizophrenia and saw improvement in the first 6 weeks, despite a significant number of people suffer side effects, including muscle stiffness, uncontrolled shaking, sleepiness, and restlessness, and this can be controlled with in certain medications too. Case study number 2 of Risperdal. Although non-pharmacological treatment for behavioral disturbance should be tried first, medications often are needed to enable the patient to be adequately cared for. Current guidelines recommend using Risperdal or olanzapine to treat psychosis in patients with dementia-related psychosis. To minimize these side effects, This medication should be started at low dosage that are increased incrementally. Overall encounter on patient teaching. Patient receiving haloperidol decanate long-acting injection may notice some pain at the site of injection. This pain should be resolved within a few days. Notify your healthcare provider if you ever have muscle stiffness, shaking, tardive dyskinesia, neuroleptic malignant syndrome, or weight gain caused by the medication. If you experience side effects from your medication, discuss them with your provider. Some side effects may pass with time, but others may require changes in the medication. Use a calendar, P-box, alarm clock, or cell phone alert to help you remember to take your medication. You may also ask a friend or a family member to remind you or check in with you to be sure you are taking your medication. Application to culture and diversity. Clinicians' ignorance or neglect of patients' culturally shaped health beliefs and expectations often guarantees therapeutic failure. To maximize therapeutic response, general agreement in the expectation and beliefs between clinician and patient is crucial. Better communication and increased trust will lead to greater patient satisfaction and better adherence to treatment. Therefore, neglect of this issue can lead to miscommunication, distrust, medication non-adherence, diminished placebo response, and treatment failure. Conclusion. Typical antipsychotic drugs, such as haloperidol, traditionally have been used to control psychotic and behavior disturbance in elderly patients. But these drugs have troubling side effects. Extrapyramidal symptoms can cause stiffness, immobility, and falls, and are associated with significant morbidity. Haloperidol is a medication that works in the brain to treat schizophrenia. It is also as a first-generation antipsychotic or typical antipsychotics. Haloperidol rebalances dopamine to improve thinking, mood, and behaviors. Patient receiving haloperidol decanate long-acting injection may notice some pain at the site of the injection. This pain should resolve after a few days. All antipsychotics have been associated with a risk of sudden cardiac death due to an arrhythmia. To minimize these risks, antipsychotic medication should be used in a smallest effective dose when the benefit outweighs the risk. These are my reference. Thank you. I enjoyed the class.